What's up everyone, Dr. Sagar Patel here, board certified facial plastic surgeon out in Beverly Hills, and today we're talking about chin implants. Specifically, we're going to be talking about the risks of getting a silicone chin implant. Now this is a procedure that can be done to build volume in your chin. There's many different sizes, shapes, and techniques to augment the chin, whether it's filler or a genioplasty. This video is specifically going to talk about silicone chin implants, which is a surgery I specialize in. There's other videos out there that you can check out that I've made talking about whether to know whether you need a chin implant, a little bit about the basic techniques in the surgery, but in this video we're specifically going to talk risks. Now, in a chin implant, there's two ways to do it. The first risk is going to be scar, and that's if you do the surgery from the outside. It can also be done internally from inside your mouth, and this is a technique that is used by some surgeons, and definitely something you want to ask your surgeon about which one he or she prefers and why. Now, these two techniques are going to have a very different risk profile, and that's why I began by talking about the approach and incision taken, whether you're going intraoral or through the mouth, or submentally or through the skin right here. I prefer to go underneath, even though I was trained to go through the mouth, and here's why. So the biggest risk of going from the outside comparatively is going to be you have a scar. I would like to tell people that if you have a scar under your chin, the least of your concerns is going to be someone thinking it's from a chin implant rather than any other reason why you would have a scar under your chin, which most of us have one anyways. And so for that reason, I really tell people that shouldn't be something that's detrimental for them. Now, if you're a 6 foot tall model who always has people looking from beneath her, that may be something to consider. But given the fact that the intraoral approach has more risks, I now prefer and exclusively use the external approach. Now, the intraoral approach, generally you want people to be asleep because you need to be stretching the mouth. It's a little bit more traumatic to be working through the mouth. And in addition, more importantly, the mouth is dirty. Our mouth is filled with bacteria, and the most important aspect of this procedure is that it is of utmost sterility because we're putting an implant which can easily get infected. We'll talk about that later. But as you're going through the mouth, there's no way to prevent any bacteria from entering the area, and that's going to lead to a higher infection rate, quoted to be as high as 10%, although I would say it's definitely not that high, but certainly by definition, it's got to be higher than going externally. Now, let's get back to talking about the external approach and what the risks are specifically with that. So when you talk about chin implants, you're going to have any surgical risk, which is going to be the risks of anesthesia. I typically do it awake, so that minimizes that. Doing it awake has more advantages than just cost and avoiding risk. Specifically being, if you're awake, we put in tester implants called sizers, and you, the patient, can help me decide what kind of and size of implant you would be best with. As we put in different sizes, you get to look yourself, and you can go with your gut telling me whether you'd like bigger, smaller, or if we found the implant that's just right. Now, that being said, when you're awake for the surgery, there's obviously a little bit more discomfort. You feel a lot of pressure, but generally I like to use that approach for most chin implants. Now, back to the risks. We have the risks of any procedure, which include anesthesia, as we just discussed, scar, which we already discussed, infection, and bleeding. Bleeding is pretty minimal in this area. We're working through a smaller area, and even though there's some larger vessels on the sides, we use compression, direct visualization to stop bleeding, and with that, it's a pretty rare risk. I can think of one patient I've ever had that had a collection of blood after surgery, and that was all fine and dandy once we realized it, took out the blood, and put some more pressure on, and the patient turned out just fine. Now, infection is the biggest fear of this surgery.
Oh, hell no!
Typically speaking, there's two types of infections I've seen, and one requires a more vigorous approach. So an infection of the implant site itself, for a couple days we can try antibiotics, but if it's not getting better, which usually is going to be the case, the implant, which is the source and nidus of the infection, needs to come out. When the implant is out, we have to basically start all over again and make sure the infection is cleared with continued antibiotics, and then we can replace it at least a couple months later once we've figured out that their infection has fully resolved. Now, the other type of infection we see that's usually when someone tells me they have a little bump and it's a little tender, that's my hope, is just an infection of a stitch where the skin is closed. A little stitch irritation can lead to that, and although that's the best case scenario because generally it's just antibiotics or even removing an irritated stitch can take care of that, and we don't have to do all the rest of the approaches. Now, specifically with implants, there's a generic concept of how to get the best results. The risks are going to be specific to implant positioning. One is going to be malposition. So an implant can slide, either rotate or slide left or right. Rotation is actually going to be more common than left and right, and generally that rotation is going to cause the implant to shift. Now, the beauty of implants is they are perfectly symmetric, and even though that's the case, the patients rarely are. So some level of asymmetry is expected, and an implant very rarely will correct any major baseline asymmetry. Now, that being said, the surgeon's job is to place it in the right pocket, the right plane, create an adequately sized pocket that's not too big or too small that can push the implant. It takes a couple days to settle, and that way, once the implant sits in its right position in a pocket of periosteum or the encasing of the bone, it cannot move.
Anyone can pull it once it's been pulled.
We have patients tape for about 5 days, but once it's settled, it's really impossible to have it move. You can take a wrench and try to move it after a couple months, and you will not be able to. We generally just ask that for the first couple of weeks, patients don't do anything like this, or this, or this. But after that, it's settled, we really don't have any problems with movement. Generally speaking, rotation is a concern, and that's why pockets need to be precise and even, because even when we do secure it, I don't use screws because it really doesn't make sense. If you put a screw here, it's not going to really prevent that. If you put stitches here, it's not going to majorly prevent that. And even though we do that, that rotation is going to be what causes malposition. And precise pockets are going to be the key to that. Now, last but not least, we have migration up and down. When you place an implant from inside of the mouth, it can easily migrate up because we're releasing everything above, and that's another reason I don't like placing implants from above. Generally speaking, I've never seen an implant so malpositioned inferiorly, because once again, you want to create a precise pocket at the inferior border of the jaw, with the key step for all our surgeons out there, freeing the decussating fibers of the mentalis centrally and slightly laterally so that there's no way that the implant can be shifted up. That's going to be the most common reason for surgeons out there that we see an implant rotating, is that those fibers weren't freed on one side and it flips up. If you are placing the implant as a surgeon and it's not sliding freely, it's not staying in position, you need to recreate the pocket and make sure it's precise, because that's going to be key. Now, the last thing to talk about in terms of risks is going to be risks to the mental nerve. The mental nerve are two nerves that come out between our first and second premolars right around here, and those nerves control sensation to this area. Very often they're in the surgical field pretty close to the implant, and patients will even, especially as we're putting the implants in, feel some tingling and numbness in their teeth, and in those circumstances that will get better over time. But what we don't want to do is make sure that those nerves are cut or damaged in any way, shape, or form. I have seen implants that are malpositioned that sit on the nerve, so if you have severe numbness for weeks, likely the implant needs to be repositioned. But for the most part, sometimes just placing especially a larger implant in that area creates a spacer between the nerve, which comes through the bone and the skin and stretches that nerve. That stretch is always going to give someone a temporary numbness, which eventually we get used to. For most people, it's not overly bothersome for a couple of weeks. For men, it can really be tough when you have to shave and it's numb, but eventually if that goes away, it's not a major problem and not necessarily a complication, because especially in larger implants, we can expect that. Now, I know that's a lot of information. Chin implants, while the risks are standardized for each patient, the implant can be customized and the utility of it is very individualized. If you have any questions, please leave a comment below. Don't forget to subscribe to our channel and like this video. For more content, please check out the rest of our videos, and thank you for watching.